Really quick recap on part 1 lecture from infection control. The types of infectious agents are bacteria, viruses, fungi, parasites like protozoa, metazoa, and ectoparasite, and rickettsia, okay? These are the types of things that can infect your body and make you sick. Bar none. So, the reservoir or the source. The reservoir is the place where conditions are ripe for replication. Moist, warm, whatever that bacteria or pathogen needs to survive and to be happy is what that environment will look like. It can be a person or an object. Examples are people, equipment, food, water, animals, and insects. Insects carry viruses. Animals carry disease. People carry disease. Equipment, surfaces can have the disease on it. Food can be contaminated. Water can be contaminated, etc. So the portal of exit. Now, I know we've already talked about this a little bit in part 1 lecture when I showed you the chain of infection, and we talked about the different stages and the different ways to break the chain for each section. But this is breaking it down further into explaining exactly what each of the chain or the links in the chain are. So the portal of exit is how the pathogen departs the reservoir, which is where it comes from, or source to another by way of body openings. Microorganisms leave the reservoir through the discharge of body secretions, excretions, respiratory droplets, and blood and bodily fluids. They can make either direct or indirect contact with another host. Does anybody remember the terms that I used when we learned about direct contact and indirect contact? What were the other terms associated? It's in your notes. At least it should be. Huh? What are the other names for the direct contact and indirect contact? Jen. Fomite and exudate. Absolutely. Very good. So, either direct or indirect contact with another host. So far we know that the reservoir is where the disease lives or where the pathogen lives, right, before it infects the host. So it lives in the reservoir, wherever it comes from. Let's say it's hepatitis A and it's from contaminated food, okay? And so that contaminated food is the reservoir, okay? And then the portal of exit would be when you actually take in the food, the contaminated food, it gets into your body that way. So that would be, there's really no portal of exit for food per se in this example. But if one of you had the flu and you sneezed and your sneeze sprayed all over the side of another person, heaven forbid that happens because that's sick, ugh, then that was the portal of exit. That sneeze was the portal of exit. Does that make sense? Is everybody following me on these two processes right here? Okay, then I will move on. The means of transmission is how the infectious agent travels through the portal of exit to a susceptible individual. It can occur through direct or indirect contact. Direct contact is touching, eating, drinking, could be kissing or sexual intimacy. Indirect contact is inhalation, fomites, or vectors. So, and if you inhale it, it's not right on top of you. You maybe walk through a sneeze. And that's something that wearing a mask is really important in public right now during the global pandemic, because somebody could sneeze that doesn't have a mask on, and then you walk through it a couple seconds later not knowing that they just sneezed there. And then you take a breath in as you're walking through that, and you just inhaled that person's sneeze. I can't be serious enough about this. That's terrible. It's really important that we follow the rules with that. A vector, we'll learn more about vectors later on, but a vector is like a bug, like a flea or a tick that lands on an animal or lands on a person and then bites them and infects them with the disease that they're carrying. We'll talk more about that later. Okay, so portals of entry. Your mouth is a portal of entry. Your nose is a portal of entry. Your throat is a portal of entry. Your eyes and your ears are portals of entry. Your intestinal tract is a portal of entry. Even though you have to go through a bunch of other things to get to it, it's still a portal of entry. Your urinary tract is a portal of entry. Your reproductive tract is a portal of entry, and any open wounds and or breaks in the skin are portals of entry. Any questions on that? To be a susceptible host, you have to be, it has to be something that is capable of being infected. And disease fighting capabilities are low. If you have the flu, your immune system is compromised during the time that you are sick with the flu, right? So that means you're more susceptible to catching another type of virus or bacteria even. Because your immune system isn't as quick to fight in that situation. Excuse me. Sorry, that was weird. So, your disease fighting capabilities could be low due to poor health, nutritional habits, or hygiene. We talked about that when I showed you that link in the chain, right? If your hygiene's bad, like if you don't brush your teeth, you can die from an infection that you get in your mouth from not brushing your teeth. It can get into your bloodstream, cause septicemia, and then that can kill you. Like, it's not a joke. Bad hygiene can kill you, literally. Okay? It can compromise your immune system, make it so you can't fight off disease, and then bing, bang, boom. Now, think about when we looked at the movie, we watched the movie with Frank the other day. Frank has terrible hygiene, right? I mean, we all saw the toe. He's gross. He also happens to eat food that was in a monkey's mouth and then rolled around on the ground. It was only a matter of time before he got really, really sick. That's kind of what I'm trying to express here. But it also can be people that have bad health. Like if you have a chronic health condition that you have no control over, it just is what it is, that can compromise your immune system as well. Individuals who are elderly, frail, immunosuppressive, or have chronic disease or trauma are particularly susceptible. Why do you think that is? Right, because they're immunocompromised. They don't have the ability to fight things off like we do, right? Infectious disease processes. So this is important. This is the process for the infectious disease process. I've got to come up with a different word for that. The incubation stage is stage 1. The prodromal stage is stage 2. The acute stage is stage 3. The declining stage is stage 4. And then the convalescent stage is stage 5. Immunity is best when your body is in a state of good physical, emotional, and mental health. So this is actually really interesting. And in 2020, I think people talk more about mental health now than they ever did. So let's talk about it. Why does mental health affect your physical health? Why does mental health affect your physical health? Let's think about it. If you have depression and maybe you're in a low phase and you sleep a lot, right? You're not moving around. It causes maybe some circulation problems. Or maybe you're not eating, or maybe you're not sleeping. Not sleeping is very dangerous to your health. Your mental health impacts all of those different body functions, right? I know when you get really low, sometimes you just don't have the energy to do anything at all, much less take care of yourself. You know, not showering for days at a time. Those are things that happen when your mental health is not in a great state in severe cases, and it can be really dangerous to your health. You need to move around. Like, we sit in these chairs all day. That's not really great. That's why it's important that we stand up, we stretch it out, we move around as much as we can while still being successful, because, that's our job, is to take care of ourselves, and to be the best version of ourselves that we can be, right? So moving on, your mental health absolutely impacts your physical health. I think that's pretty well understood. The defense against disease maintained by proper exercise, adequate rest, good nutrition, and proper hygiene. The term for that is homeostasis. If you have homeostasis in your own body, then you have all of these things. You have proper exercise, you have adequate rest, you have good nutrition, and you have proper hygiene. Questions on that? Pretty straightforward, right? Like not a big deal. Okay. Why do you think it's important that we get enough sleep, just randomly? Sure. Sure. Absolutely. Focus is definitely one of them. What about just like impacting your direct health? So like if you don't sleep, your body doesn't get to recuperate, right? You don't get to recharge. So then you get really tired. And then you just stay tired. And then maybe your thought process gets affected, like Jen said, and you can't focus. You know, there's a lot of different things that could go really wrong with that. All right, so specialized defense mechanisms. All right. Inside of your respiratory tract is this hair-like substance called cilia. Say cilia. Cilia. Okay, a little bit louder. That was lame. Cilia. Thank you. Okay. So cilia catches anything that comes into your airway or tries to before it can get into your mucous membrane. So inside of your nose is hair, right? Everybody has hair inside their nose. Some have more obvious hair than others, my husband being one of them. Anyways, so inside of that nose hair, it like prevents bacteria when you inhale. You're inhaling and it says nope, and it stops the bacteria from going into the mucous membrane lining, you know, of the respiratory tract and implanting and making you sick. Just like when we saw on that movie we watched the other day, you see those little characters that were like running around trying to prevent the bacteria from getting into the respiratory tract. That's what that is. Coughing and sneezing. You know, allergens, your nose tickles, right? You get a tickly nose. That's your body's way of being like, there's something in here that doesn't belong here. I will make it come out with a sneeze, right? Does that make sense? Coughing, same thing in the lower respiratory tract. Something in there your body doesn't like and it wants to get it out. Okay. Tears, sweat, urine, and mucus wash pathogens away from the body. Every time you cry, you're wicking pathogens away, especially if your eyes are just watering. It's your body's reaction to get rid of something that's in there. Sweat. Every time you sweat, you're getting things out of your body that don't belong there. Urine, when you urinate, usually you're getting stuff out of there, like you're getting rid of good and bad stuff, extra minerals that your body doesn't need, and also pathogens, microorganisms. Mucus, have you had a cold and you're like coughing up phlegm? That's trying to get rid of stuff right there. And hydrochloric acid in the stomach has a low pH, which discourages bacterial growth. So the higher the pH in your stomach, the more chance you have of getting a bacterial infection in your stomach, like colitis, gastroenteritis, etc. Any questions so far? So, being in a global pandemic, I think we've learned a few things about how to stop the spread of infection. Name two. Keely. Wash your hands. What's the second one? Like, what's the second? Yeah, like, okay, so Phoenix said wear a mask or, you know, cover your mouth when you cough so that you're not projectile shooting things 6 feet away. What about social distancing? Would you consider that a way to prevent infection? You know, that's great. Okay. Okay, so that's a really great question. Money is filthy, right? Yes. Filthy. Gas pumps, filthy. Grocery carts, even though they're trying to clean them, filthy. But all of those things involve what? Your hands. So if you wash your hands frequently, you're going to continue to stay safe from the pathogens that are on those things, right? So if you touch money, what should you do immediately after? You should wash your hands. If you pick your nose, what do you do immediately after? Don't pick your nose, but if you do, wash your hands. If you touch a doorknob, what do? Wash your hands. That's why it's really important that we're washing. How long do we wash for?
20 seconds.
20 seconds at least. And you need to use soap that gives a good lather, because that lather and that friction is what kills that bacteria, right? Okay, so as a medical assistant, it is your job to educate your patients. If you have a patient coming in and they get sick all the time, it might be beneficial for you to say, hey, you need to start washing your hands more often. You need to start coughing into your elbow. Maybe not, licking doors and stuff. Like, just make better choices. But patient education, you're going to teach your patient how to properly wash their hands, how to wear their mask properly, etc., right? Proper cleaning. People never think about this, but you also have to clean your own house, because when you come home, you bring all that stuff home, right? So just think about that. It's definitely something to pay attention to. Your car. How many times do you get in a car from touching something in a store, you haven't washed your hands, and you touch the stuff inside your car?
Actually, it was
Good, but how many times have you done that? I know I've done that. I just did it yesterday. I took my daughter to my daughter skateboards, and I took her to a skateboard shop to get a new board for her birthday. And by golly, I touched the door, I touched the skateboard, I touched the register, got in the car, didn't even think about it. Didn't wash my hands, and then touched my steering wheel and my gear shifter on my car and the push button that starts my car. So there were 3 things I went, oh crap, and then I had to take a Lysol wipe and clean all of those things and sanitize my hands. That was silly. I could have spread infection right there. How many of you work? You go to work, you clean at work, sure, but are you getting in your car and not washing your hands before you do that? No, you're washing your hands, right? Are you sanitizing your hands frequently throughout the day? Are you guys taking the appropriate measures to clean things as the CDC has told you to do so? That's all stuff that you have to keep in mind. It's really easy to forget, right? It is. We're humans, we're busy. For instance, I've had 4 things going on just since I started this lecture. There's a lot of stuff happening all the time in our lives. And so to get into a good routine of anytime you touch your face, sanitize your hands. Anytime you touch anything, sanitize your hands. That's how we're going to beat infection in general, not just COVID. All right. Practice universal and standard precautions. So that video that you guys watched on Wednesday, that girl was cleaning that equipment. She was scrubbing those instruments and then putting them in a vat of water and ultrasonic cleaning them. And then she was also putting them, after that was done, into an autoclave, which cooks it with steam and pressure. Those are all methods of cleaning instruments and sterilizing instruments. But what about the chair that the patient sits on, right? So you have a kid come in for a dental procedure, we have to wipe that chair down, right? Even if there's table paper on there and the kid never touches the physical chair, you still have to wipe that down, because table paper is porous, which means that things can get through it, right? You still have to wipe down the door handles frequently. You still have to wipe down, drinking fountains should be shut off right now due to COVID. But you have to clean all these things. Universal and standard precautions dictate what needs to be done all the time. And these are things that should have been done pre-COVID. Let's be realistic. Maybe they weren't done to the level that they are now. But this is what should have been done pre-COVID. All of the changes that fast food restaurants have made, it should have been that way before. If you think about it, it really should have been. Moving on. Follow OSHA guidelines. Does anybody know what OSHA stands for? No, but you're not totally far off. Yeah. Occupational Safety and Health Administration. I like yours too, but I'm just saying that is what it stands for. These are your bloodborne pathogen standards and your report of exposure incidents. These are also the people that make the rules. So a lot of the rules come from them, saying you can't stand on a ladder that's so many feet tall if you work in a hard trade, or you can't touch needles with the tips. You can't touch the tip of the needle to your fingertip and stick yourself. You're not allowed to do that. It's an OSHA guideline. Safety first. Infection control and disease prevention continued. Needle sticks and other sharps. You'll notice in the classroom there's not a ton of stuff out on the counters because I have to lock it up for safety reasons, but if you look to the back, you'll see a red box with a white lid on it. That is a puncture-proof sharps container. I can put needles of all kinds in that box back there, and they will not stab you. They cannot hurt you once they're in that box. Those are what we use for all needles that we use in this classroom. A blood spill cleanup kit. I don't have any of these on me, but downstairs they have them, so if I ever needed one, I could get one from them. But there's a procedure for how we clean up blood. Disposal of hazardous waste materials. There's a trash can in the back with a red trash bag on it. That's for hazardous material. We don't actually throw hazardous material away in here. So for us, we don't have to worry about that. But that's for like soiled linens or large amounts of blood. The amount of blood that we deal with in lab is very minimal, and we can actually dispose of it in the sharps container or in a regular trash can because it's not considered hazardous. Regulated waste and infectious laundry. Again, soiled linens. That's definitely something you would deal with at a hospital, not necessarily a nurse like an office, but like a nursing home or a hospital. You'll deal with those. And then incineration. A lot of trash gets burned in healthcare, and that's because that's the best way to destroy it. It used to get dumped in the ocean. I hate to even admit that, but that's very true, and there's probably some companies that still dump it in the ocean, which is horrible and illegal. But the way that a lot of stuff gets disposed of in healthcare is through being burnt. It gets incinerated and turned into ash, and then the ash gets disposed of. So, hand washing. All right, this is it. This is the part that everybody needs to pay attention to, because what you've learned to do washing your hands wise is different than what I teach you to do. Because we wash for medical asepsis in here, not for just cleanliness. Like we're doing it, we're going a step further, so pay attention. Hand washing is essential in the infection control and eliminating the potential to contract disease. As you can see these pictures here, they've got a nice lather. They go all the way to their wrist. I always go about 1.5 inches above my wrist just for safety reasons. So when we do start actually practicing medical asepsis hand washing, if you wear a watch, you'll need to take it off, and you will need to sanitize your watch as well. And that's something that people don't ever think about. Sanitize your watches. Sanitize your phones. Right? They're disgusting. Like literally. Like disgusting. It's terrible. Okay. All right. Perform vigorously for at least 15 seconds. Now in healthcare, we always go 20 to 30. This 15 seconds is just a basis. You want to do it before and after seeing each patient. So when we start checking off on skills, you're going to sanitize and or wash your hands before you come into the patient room and when you leave, okay? Before and after eating. How many of you actually wash your hands before and after you eat? Like,
It depends on what I'm eating.
if it's something you have to hold with your hand, you think about it more, right? But if you're using a fork, you don't think about washing your hands, do you? You should. That's good, because germs can fall. Like pathogens can get on your skin and crawl onto forks and move. I mean, you saw in the movie we watched how the pathogen transferred from an eyelash, fell into something else. Like stuff happens. Before and after using the restroom. I don't even want you to raise your hands about that one. Before and after handling specimens or any soiled, contaminated materials, even if you're wearing gloves, which you should be. If you're handling urine cups to do specimen drops or specimen dips, or you're doing throat cultures, you should be washing your hands every time before you put your gloves on. When you put your gloves on, you've got them on, and then after you take your gloves off, you wash your hands again, right? Because you're not just protecting yourself, you're protecting your patients. And then you always, always, always wash your hands after you take off your gloves, okay? That is a requirement. Now, something else we will be talking about, but I don't teach because I don't teach surgical assisting to this level. We do learn it in senior year, but not to this degree. Surgical scrub hand washing is before gloving for a surgical procedure, and you scrub for 2 to 6 minutes. Average being 4 to 6. I would say 4 to 6 is more appropriate. You use a certain soap. Oftentimes you'll use a betadine scrub to scrub surgical procedures, and you scrub all the way to your elbows when you wash your hands for surgery. You go from the tip of your fingers all the way to your elbow, and they actually have like a scrub brush that has soap inside of it and it's disposable. So the minute you've used it, you just discard of it. And they wash all the way up here, scrub, scrub, scrub for 4 to 6 minutes. Using an alcohol-based rub. Sinks, when they're not readily available or hands are not visibly soiled between patients, listen, if you can't wash your hands, that's okay. Use hand sanitizer, but don't rely on hand sanitizer because it is not 100% effective. Hand washing isn't always 100% effective either, but if you do it right and you lather and you rinse and you don't flick and you don't make a big mess, it is effective. And hand washing is always preferable over sanitizer when available, okay? Just as a heads up on that. Gloving, necessary when exposed to blood or bodily fluids. You always need to wear gloves. I don't care what you're doing at this point with the way things are with the pandemic and infection control now. Unless you're doing something where you're not dealing with a patient at all or you're not touching anything bodily fluid related, just wear your gloves. Always, 100% of the time, okay? It provides a barrier of protection. I will be teaching you how to put gloves on properly and how to remove them properly. It reduces the transfer of pathogens, but it is not a substitution for washing your hands because you always wash your hands after you take off your gloves, right? Right? Okay.